Welcome back to the Health and Wealth Radio Show with Jeff Juniper. Our number, as always, 949-239-3586. And you can find us online at healthandwealthradioshow.com. Well, as we always say, we're interested in helping you with your financial health, but we're also interested in helping you with your physical health, because as we get into our retirement years, we want to enjoy our retirement, and that means we got to pay attention to our physical health as well. We bring area doctors in to talk about interesting topics that should be of concern to you. And Jeff, we have another great guest today.
We're very lucky today to have with us Dr. Catherine Ross. Catherine Ross is one of the top gastroenterologist in Orange County for over 25 years now. She has a practice in Newport Beach, and she's devoted to excellence in medical treatment. She's an expert in matters of the stomach and digestive tract and is board certified in internal medicine and gastroenterology. She has also done a fellowship in nutrition at UC Davis and is a fellow of the A4M, which is the Academy for Anti-Aging Medicine, and she is now dedicated to educating her patients about healthy lifestyles. Dr. Ross has lived in Orange County since 1979, so she has two medical practices here in Newport Beach, her gastroenterology practice and Gentle Touch Aesthetics, where her motto is, beautiful you inside and out, and I truly believe with that. Dr. Katie, welcome to the show. We're very glad to have you.
Thank you, Jeff and Randy. It's good to be here.
Well, fantastic. For the listeners out there, this is going to be the first part of a 3 or 4 part series, and we're going to talk about nutrition and weight loss. I was amazed to find out that almost 40% of Americans are obese, and so we've invited Dr. Ross in to help us try to understand how we can have better nutrition and reduce our weight and get those numbers down. So let's go ahead and let's get started. And today we're going to talk and we're going to discuss obesity and weight loss. Tell me, Dr. Katie, why does that subject interest you?
Well, it's a subject of interest to just about everybody. 2,000 years ago, Hippocrates, the father of medicine, said, "Let thy food be thy medicine." And I think that we need to go back to that today and consider food as a medicine for most of us. Over the years, I've seen many patients develop chronic diseases. I've seen multiple specialists for different types of medical problems. They end up on a lot of medications. They have illnesses like hypertension, metabolic syndrome, which is basically pre-diabetes, also cardiovascular disease and diabetes, and many other types of things, even cancers that are related to obesity, such as colon cancer and breast cancer. So a lot of these things have been shown to be related to weight gain and obesity. So I also have some personal family experience with obesity. I have a developmentally disabled daughter who gained tremendous weight over a period of years. She got up to 325 pounds, had to use a walker to get around, and had a lot of medical issues, obviously. She was on lots of medications, and it was a very difficult situation to deal with. She's an adult living in a group home, so I had no control over her diet. And her idea of dieting, well, if she had some diet foods, she felt that she could magically lose weight by eating those diet foods in addition to anything else that she wanted to eat. So she really had no understanding of weight loss. And eventually, as I said, her weight got so high that she went for gastric lap band surgery, which in some cases, and in her case in particular, is very appropriate. So it's taken a few years. She's had gradual weight loss, now down to 155 pounds.
Fantastic.
Threw away the walker, off of a lot of her medications, feels much better, and she's a lot more active.
Well, so I can see that you have some personal reasons that are, and you're very passionate about this. I know that during our discussions, we have a lot to cover here, and I'm glad that you were able to help your daughter, and that helps our readers understand that you really do walk the walk, so to speak, when it comes to taking care of our health.
Absolutely.
Dr. Katie, how big is the problem of obesity today in America?
Well, it's a big problem, and it's growing. There's an ancient Egyptian proverb which says, 1/4 of what you eat keeps you alive. The other 3/4 of what you eat keeps your doctor alive. So right now, Over 2/3 of Americans are medically obese. That's 35% of American adults are obese, and 40% of women are actually obese. That's a recent statement by our government. 1 in 20 are now morbidly obese with a basal metabolic index, or a BMI, over 40. That generally means that those people, to get down to a normal weight, have somewhere between 80 or more than 100 pounds to lose.
Wow.
So our children are also getting obese. More than 30% of them are obese, and we're seeing increasing diabetes in these kids and teenagers, and that's a real problem.
Well, you might not have known this, but Randy and his wife just recently, over the last 18 months, have been on a diet, and Randy informed me that he lost 40 pounds and has kept it off, and his wife has lost 55 pounds. So,
Oh, that's wonderful.
Yeah, it
So
was
my-
it was quite the diet change and the whole lifestyle change, and that's what I think that a lot of people, they look at me and they go, "When are you going to go off your diet?" And I say, "I'm not." It's got to become a new lifestyle, and that really is what it comes down to, isn't it, Doctor? Is you need to change your whole lifestyle.
Absolutely. That's absolutely true. We spend over $120 billion in this country annually on healthcare, and 75% of those dollars are spent on chronic diseases that are related to our diet and our lifestyles. So people know that they need to lose weight. People want to lose weight. Over $20 billion are spent annually on weight loss products and programs. The sad part is a lot of people will lose the weight. If they don't change their lifestyle, the weight comes back.
wow.
And
So it's like a yo-yo.
it's a yo-yo dieting effect. I think we've all experienced that in our lifetimes, if not personally, then with family members. And this really saddest part, a lot of the weight loss, people say, oh, I lost 20 pounds, but they didn't just lose fat. Unfortunately, depending on the kind of diet that they're on, they may have lost a lot of muscle tissue, and they may even lose protein and muscle from vital organs. So the metabolic rate also goes down, and there have been studies that show that that metabolic rate may never return to a normal level. In fact, Kevin Hall is a person who did a study on some of the biggest loser contestants. So he looked at 16 contestants from that popular television show, and he looked at them 6 years after the show had ended. Now, those contestants are under contract for at least a year to keep the weight off, because they're touring around and they're giving some talks and letting people see how much weight that they've lost with their before and after pictures. But after 6 years, all of those contestants had regained much, if not all, of their weight, some even more. And they looked at the metabolic rates of them, and the metabolic rate of every one of those people had dropped, and it never came back to what their baseline was.
Wow. So to rewind a little bit, there might be some unintended consequences, and I'm sure there's a lot of listeners out there that might want to get a hold of Dr. Ross and come in for a consultation. This is a good time. I'd like to give you her telephone number. Her office number is 949-650-8700. That's 949-650-8700. Ken, let's talk a little bit now about some of the problems and diseases. I know we touched on them briefly, but what are the biggest diseases that are related to obesity and some of the problems that are subsequently created by being overweight? Or I guess it's kind of like a catch-22. You can't have one without the other.
That's right, unfortunately. So we're seeing high blood pressure, metabolic syndrome, which, as I said, that's a form of pre-diabetes, type 2 diabetes, cardiovascular disease, which really involves atherosclerosis, which is hardening of the arteries, also angina, heart attacks, and strokes. Over 650,000 deaths occur in this country due to cardiac event, and 300,000 of those are sudden deaths. In other words, the people die, they've had no predisposing symptoms of chest pain, so there's really no warning. That's about 1/3 of patients who will die of sudden death who have 0 to 1 cardiac risk factors. Now that's an alarming statistic. An example of that, kind of a sad example, Tim Russert. He was a host on Meet the Press for over 15 years. He had sudden death at age 58.
Wow.
Now, he had had normal labs and even a normal stress test within 2 months prior to the event of his death. So a lot of cardiovascular disease is subclinical, and people shouldn't be lulled into complacency that everything's okay, because even though they have these diseases, they're on medications and their labs look pretty normal. So, they feel like they don't have to worry.
So what was the cause of Tim's death? Was it eating habits, bad nutrition, do you feel?
Well, he was overweight. He had metabolic syndrome and he had high blood pressure, but he was on medications for those things. And I'm not sure if he was dieting at the time. He might have been one of those people that dieted and gained it back. But the fact that he was on medications and his labs were normal, I think that, that probably led him, as it leads millions of other people, to think that everything is okay.
So I'm picturing somebody that might be a little bit overweight, such as myself. And although if I have high blood pressure and I'm taking my meds, I've lulled myself into thinking everything's okay when really it's not. I need to lose that weight, reduce my meds if I can, clinically get off of that, because it's a false sense of security if we're not minding the ship, so to speak.
That's absolutely true. So to lose weight, one has to change the way that they eat and change the way we think about food in many cases. Now, in the case of Tim Russert, you asked what actually was the cause of his death. Well, there was an autopsy, and it was determined that he had thrombosis, and actually one of the blood vessels of his heart caused the event.
Oh.
And that can occur even with very new changes in the cardiac vessels. The buildup of, inflammation comes first, and then particles that come by, such as the cholesterol, can attach themselves, and it builds up to levels of causing obstruction or near obstruction in the blood vessels. It can also weaken the blood vessel, and it can rupture.
Well, again, I'm sitting here and you scared the heck out of me.
Well, there's some other problems lots of other problems related to being overweight or obese. There's sleep apnea, osteoarthritis, a lot of problems with the joints, and there's cancers. Cancers that are known to be related to obesity are colon cancer, very common, breast cancer, uterine, bladder, renal cell or kidney cancer, and prostate cancer.
You're listening to the Health and Wealth Radio Show with Jeff Juniper, and our guest today, Dr. Catherine Ross from Newport Beach in Orange County, a local gastroenterologist. And we are going to have Catherine on for a number of shows, and we're going to be talking about the very important topic of weight loss, nutrition, eating right, and being healthy in our retirement years. Because, Jeff, as you've said at the beginning of the program, every single week, so many of us chase wealth our entire life, and then we chase health in our latter